It's my feel-good breakfast show.
Welcome back. Thank you so much for keeping it locked as we continue with our health discussion this morning and open a new chapter as we focus on World Oral Health Day. It's observed annually in March and it launches a year-long campaign dedicated to raising global awareness of the issues around oral health and the importance of oral hygiene. Now, as this affects us all, we deemed it an important topic to discuss, so that's why we are opening up the airways to you as well. And we are joined by a specialist in oral medicine and periodontist, Dr. Fahim Bamji. Doc, great to have you here. Thank you so much for joining us. Vitally important. I think we take it for granted, actually, how important our oral health is. Let's start with the bad news first. What are the implications for poor oral health in your experience?
Well, you know, if you want to smile, you need your teeth.
Exactly.
Oral health, no teeth, no smile. So obviously your teeth are important for not just social interaction and how people see you in the world, but your ability to function, chew, speak, interact with the world. So having good oral health and maintaining those teeth is obviously significant.
It's one of the building blocks, yeah. There are some serious implications if we take this to the extreme. We've heard heart disease, cancer, even diabetes can be linked to poor oral health. How does that start and how does that affect your system to lead? Because these are pretty extreme repercussions.
Yeah, so, you know, it's extreme repercussions, but what we always look at is that there's a lot of literature to go through. A lot of research has gone into these topics, both separately with cardiovascular disease, diabetes, different types of cancer, impotence for males, for example.
Wow.
But the thing is that there's no absolute causality because all of these conditions exist within a spectrum where there's what we call a multifactorial. So there's genetics in play, there's your environmental exposures, your diet, obesity, smoking, all these habits. And all these things come together, and periodontal disease is just one of these conditions which has been associated with enhancing your risk profile to develop these conditions. Okay, so we're not saying gum disease and poor oral health
causes cancer, but it's a mitigating factor.
But
yeah,
it's an important associated factor or risk factor.
Yeah, and I think it often becomes, I suppose, like a litmus test for your overall health as well. It's a good indicator. Gum disease. How would you define gum disease? What's the difference between an unhealthy mouth and we've now taken it to that degree?
Yeah, so there's different types of gum diseases, but let me try to break it down to the very simple basics. Okay, your two main gum diseases are gingivitis, which is inflammation of the gums. Okay, and this can be very mild, you know, occasional bleeding when you're brushing your teeth, when you're flossing, a little bit, it's very painless, and for the majority of patients, this will not lead to really serious health.
And if you maintain your kind of oral hygiene, it'll pass.
Okay,
yeah.
so good oral hygiene, brush your teeth, floss, go to the dentist, have scale and polish, and it's all cleared. The second type of gum disease is the periodontitis. So now this is when inflammation affects the bone and the supporting structures of your teeth. And this is where that association with the other conditions, and it's the entry point for bacteria and those toxins of that bacteria into your bloodstream. So losing the tissues, the supporting bone, and the ligaments around your teeth, that's where things go.
That's when it starts to seriously tank. What are the signs then? You mentioned, obviously, bleeding gums being an indication of gingivitis. When it comes to the more serious implications, what are some of the signs that we need to look out for?
Gum disease, for the majority of patients, is painless. Bleeding gums is all you'll have, and for many years, you'll notice a little bit of bleeding when you're brushing your teeth. As you age, depending on how fast that disease progresses, you'll notice maybe your teeth appearing a little bit longer, the gums have receded slightly, teeth may be moving a little bit. And for the most part, that's the greatest aspect of the spectrum of conditions. So it's until very late in the gum disease process where you'll find significant pain, movement of teeth, mobility, and ultimately your teeth fall out because, you know, we've lost the bone and support.
That structure, that lattice that protects them, which then means that we need a good relationship with someone, a professional, to help us. We're going to get into when we should be getting or leaning on our professionals' help. We are going to have Dr. Bamji with us for the rest of the show, answering some of your questions as well. So if you've got any oral health-related questions, let us know. Hit us up on our Expresso Morning Show Facebook page. We'd love to get through them. But we're going to talk about some treatment options and what his job is on the other side of this.
It's my feel-good breakfast show.
Let's be honest, a smile can offer so many things. A friendly greeting, it offers a mood boost. In fact, it also helps our bodies release cortisol and endorphins, believe it or not, and that provides obviously numerous health benefits and just makes us feel better. And we are back with a specialist in oral medicine and periodontist, Dr. Fahim Bamji, as we discuss the importance of looking after our oral health as one of some of the issues that can arise if we aren't following the right procedures. Doc, thank you so much for sticking around. What are the basics now? What do you tell your people when you want to set them on the right course for good oral health? What should we all be doing in our
I
daily
think
practice?
everyone knows the basics. You brush your teeth, you floss, and everything the dentist tells you. But unfortunately for many of us, no one's really taught us how to do it since we were in preschool. So everyone still does the same old thing. You put your toothpaste on and you go round and round, clean the gums, and you sing a song. And you do that until you're in
Sing
your
Happy
late
Birthday
20s
twice,
and 30s. Yeah. Okay. So if your dentist doesn't teach you how to perform these tasks in a more effective manner over time, then unfortunately you're going to end up
Going to
with
lag
something.
behind. So what should we be doing? And should we have an electric toothbrush?
I think that's optional. An electric toothbrush is more efficient at removing plaque, but with everything, whether it's electric or manual, it comes down to technique. If you don't know how to use it or use it incorrectly, you're going to either miss plaque,
Certain
calculus
spots,
or
yeah.
tartar, or you're going to cause some damage to your teeth and your gums. Many patients unfortunately brush too hard, apply
Soft
too much
tissue,
pressure,
yeah.
cause gum recession.
So ask your dentist, get the lowdown, ask him, and I know it can be specific to your mouth and what your challenges are as well, so that's a part of it. How often should we be seeing our healthcare professionals in the space? When should we be going
I
to
think
you?
every toothpaste advert has said that you need to go every 6 months.
Yeah.
Okay, so for the majority of patients, that's absolutely true. Because when you're brushing your teeth, you're going to miss stuff. You're not going to engage certain areas within your mouth, so you're going to miss a lot of plaque. And it's for the dentist to basically mop up that extra bits of leftovers before it becomes more serious, before it develops into a more dramatic type of gum disease.
Okay, so gum disease we know is one of the kind of real villains of the piece in this case. What other complications can arise from poor oral hygiene? And I think of things like
Second is
cavities and stuff.
Okay, so whether it's plaque has an influence on formation of gum disease as well as decay. So everything starts from plaque. If you keep it away, unfortunately, we won't have any jobs. So
You're right. Was that a plea? I doubt you're ever going to be out of a job because it feels like as much as we drum this home, it is one of those things, as I said, that we really do take for granted. Why do you think we are so kind of loose and fast with our teeth, knowing how important they are for us? How do you kind of wrap your head around
No,
this?
I haven't met any dentist who understands it either. I mean, we all know it's important to us, and we always look at, for example, you find patients would spend thousands of rands on skin and on facial makeup and, on plastic surgery.
training programs,
Training
eating
programs,
plans.
yeah. And, unfortunately, for some reason, teeth doesn't take that precedence.
Often until it's too late or until we've crossed the line, and then we go back and we try and repair. So let's talk about the level of repair here. And I think for a lot of people, it's kind of deemed as cosmetic, but knowing how important our teeth are, it kind of, for me, it goes beyond that. If we've damaged a tooth, we've broken a tooth, for instance, I got head-butted by my 4-year-old and cracked a tooth, can I have that repaired? Can you rebuild a broken tooth?
Yes, of course. So with dental decay, there's various types of restorations that we can perform. They can be general fillings, usually in silver or in what's called your white fillings or your bonded fillings.
Okay.
And then for higher end types of restorations, we go to ceramics. These can be like veneers and crowns or something known as inlays, which last for many, many years. They look fantastic, have a good luster, good sheen. And I don't think any dentist thinks that everything is cosmetic. You know, many of these things are functional. You need it.
It's the medical aids we need on board. But
Yeah. That's a whole other discussion.
yeah, I know, that'll be for next week's legal discussion.
Legal discussion, yeah.
What do you think is the key here? And I ask this as a parent as well, because I'm trying to instill in my little ones the idea of good oral health. How should we be approaching with our kids in setting up a good kind of foundation for them so that they don't maybe follow the problems that we've had or the misgivings that we've had along those lines? How should we be approaching our little ones' oral care?
So look, I have a 2-year-old, okay, and it starts with us brushing their teeth from the time they're babies. So before they even get teeth, massaging their gums, getting them used to that sensation of having a clean mouth, making it a daily routine as they grow into it, I think is really important. And then when you visit the dentist, take your child with.
Yeah.
Obviously, make sure it's a nice visit. You're not going to have teeth pulled out.
Don't
and
go
blood going
bring them
everywhere.
for a root canal.
Yeah, don't bring them
rather
for your
not.
root canal, okay? Bring them in for a nice, consultation and cleaning. Get them used to the dental office. Get them used to the dentist and the oral hygienist. And yeah, make it fun for them. So they see dad sitting on the chair, getting their things done, and they'll do the same.
Just normalize it.
Just normalize
I
it.
absolutely get that because it has to be a part of everyday normal function. Get it down now, and if you can bed it in with your little ones as early as possible, it is going to give them a lifetime of good oral health. We are going to turn to some of your questions in just a moment, so if you've got any questions, please let us know. Hit us up on the Expresso Morning Show Facebook page. We'd love to hear from you. But of course, we started a conversation a little bit earlier on the show, and I'm dying to hear how you feel your smile adds to your character. Let's find out.
It's my feel-good breakfast show.
Welcome back as we continue our health discussion this morning. And of course, the focus is on oral health. And what this refers to is the health of our teeth, our gums, and the entire oral facial system that allows us to smile, speak, obviously eat, most importantly. Some of the most common diseases that impact our oral health include cavities, gum disease like gingivitis, and even oral cancer. And we have loved spending the time this morning with Dr. Fahim Bamji, learning about the correct ways to manage our oral health and how important it is to have a good relationship with our dentist or our periodontist. Let's start this one maybe with some good tips on how we can all look after our teeth. What's the lowdown? How should we be approaching our own oral health care?
I think the same way how you wake up and wash your face in the morning. It's something that needs to be done daily, and it's something that needs to be takes a little bit of focus and attention to detail. So we all know we need a toothbrush.
Yep.
Okay, learning, I think, first of all, how to use it. Always floss before you brush your teeth.
Okay, before.
That removes the plaque from between the teeth, brings it out in front, allows your toothbrush to sweep it away. Okay, and if you're using the right toothpaste, for the majority of your sensitive types of toothpaste, you don't want to rinse out your mouth and spit it all down the drain. You want that minerals to actually soak in a little bit longer after you brush
The
your teeth.
enamel, yeah, okay.
Okay.
I get that, man, and it sounds simple. Just, why aren't we doing it? Why aren't we doing it, man? No, I think it really does have to become almost robotic. Just let it be a part of your daily process. Smoking obviously affects our health in so many ways negatively. How does it affect our oral health?
So it significantly increases your risk of oral cancer, okay? But other than that, it increases our risk of periodontal disease. It also accelerates the rate of periodontal disease. So we lose our gums faster, we lose our teeth faster, okay? So other than that, it has a variety of effects on the blood supply, as well as the immune function, the immune cells within our body, both within our lungs and within our mouth. And remember that this is the entry point when we smoke a cigarette, okay? This is where the heat is produced, all those toxins are filling in directly into those oral tissues.
Yeah.
They're being absorbed into the saliva, into the what we call the mucosal tissues around our cheeks and our tongue.
Because the mouth is very porous, hey?
Yeah.
It's not protected in that sense, yeah.
No, it's quite a protective area, but when we have periodontal disease, we've got what we call these little pockets of inflammation between our gums and our teeth. And these areas allow the entry, or
Chinks in the
enhance the
armor.
entry of these toxins as well as bacteria into the bloodstream, into the tissues.
I know a lot of people are really heavily affected by something that happens in the mouth, and I know we joke about it and make light of it now, but it can lead to really serious kind of effects on your lifestyle, and I'm hoping a lot of people have weighed in. I think we've got some comments and some questions coming through here, so let's have a little look-see here, and we've got Claire saying, I'm curious, why is it that when one drinks coffee with sugar, one has an aftertaste and stain, but with xylitol or canderel, the coffee doesn't seem to stain one's tongue? Sugar versus sweeteners. Would you be able to give a...
Well,
an
sugar
answer?
is a fermentable carbohydrate, and plaque is what plaque uses your sugar to actually survive and thrive.
Eats
So
it.
it breaks it down, it eats it, and effectively goes to the bathroom on your teeth.
Really? Okay.
Well, xylitol are not fermentable, so the plaque in your mouth cannot break them down. It cannot metabolize it in the same way as sugars. So you form less plaque, which means less staining.
All right, so it could be a better option. Let's see if we've got any other comments coming through here. We've got Kim saying, are your wisdom teeth still able to come out after the age of 40? Interesting one. After having a back molar pulled, I now seem to be growing another tooth in its place. Could this be my wisdom tooth?
Yeah, so I'm sure if you checked with many people, they've had their wisdom teeth removed in their early 20s or so. And for many of us, our wisdom teeth become trapped within the bone, behind the very last tooth, our number 7 molar, as we call it. And if you lose those teeth, the tooth which was trapped within the bone still has an opportunity to come up into the mouth, okay?
In that case, do you have to have the wisdom removed, or is there a place for it and you can be one of those rare individuals who...
There are rare individuals where it actually comes out fine, but for the majority of those patients, the angle that it comes
It's
out
filling a space that it
not
shouldn't.
too good, yeah. Okay, and it makes it more difficult to take care of the area in the back of the mouth. And eventually it harbors some bacteria, we undergo decay, and eventually you need to remove it anyway.
And that's a slippery slope there. Thank you. Brilliant comment there. We've got another comment coming through from Moralise Esterhazen saying, all my teeth have been extracted last year. How can I keep my gums healthy? That's an interesting one.
It is an interesting one. You've lost your teeth already, so you're keeping your gums clean is just a wipe away. You don't have to brush any teeth. Unfortunately, though, once we lose our teeth, our gums continue to shrink because the bone which supports them continues to
It's
shrink.
receding as well.
So, yes, wearing dentures is possible, but the more bone you lose, the more challenging it becomes to wear your dentures. So for those patients, you normally have to consider looking at alternative options. Specifically, we look at implant options.
Prosthetics,
And
okay.
prosthetics, okay, just to enhance your ability to retain those dentures if you're having some discomfort.
You want to keep them for as long as you can. Let's see if we can squeeze in one more comment here. We've had some really interesting ones. This one coming through from Prince Makule says, brush my teeth for 2 minutes twice a day. Don't floss that much. I use mouthwash. Does he get a thumbs up? How important is the flossing process, and is mouthwash as important or a nice kind of added extra?
There has been some controversy with the whole floss thing.
Yeah, recently, I mean, I've had another doctor sit down on this couch and say it's been proven now that we don't need a floss. Which
No, I think
seems
it
to ring
depends
all
on your
sorts of-
contact spaces, okay? So interdental brushes are actually better than floss. They fine, tiny little brushes which we use to brush between teeth. And we say that everywhere where those brushes cannot fit, floss is necessary, okay? The floss does not physically remove the plaque. It churns over the plaque. It changes the way that the biofilm or the type of bacteria adhere to your teeth and makes it easier for your toothbrush to remove it, okay? So you're interrupting their ability to cause decay. You're turning them over.
Okay, you're messing them
Messing
around. There are so many little gems in what we've taken. I've got a lot to think about. I would imagine our viewers are thinking very seriously about their oral health right now. Thank you so much. This has been amazing. I look forward to bringing you back for our next discussion. The legal ins and outs. No, I'm not going to push you down that road, but I think it is clear that we all need to institute a daily rhythm when it comes to our oral health care. Look after your teeth now so you can keep them for as long as possible. And it starts with a simple and healthy routine. Do it every day. Just make sure you bed that down and your mouth will thank you for it. Doc, thank you so much.
My pleasure, Graham.